Hi, I'm Sean Baker, certified outpatient coder, certified professional coder, the Grandmaster of Psychology. I'm joined today by guest and former medical supervisor Michelle Ilsley, MHL, RHIA, CCS, CRCR. Michelle works for an international software company now. Michelle, what was it like supervising me?
So it's been a few years. Sean and I worked together in a medical setting, and Sean has always impressed me with his desire to do a great job, his dedication to his work, and also just the energy and the passion that he has for his job. So it's pretty easy to supervise someone who really wants to do a good job.
Thanks so much, Michelle.
Of course.
So, I have an email from you back before you were my supervisor. You were the educational coordinator when you sent this note. And you sent this note when everybody was studying for ICD 10. So, for those of you who don't know anything about medical coding, back a long time ago, we used to use a system called ICD 9, and this would have all the codes to our diagnostic programs that we use to fill out the code claim. So, after a while, the government transitioned to ICD 10, and this was a huge change. We had to basically relearn all of our coding diagnostic um, programs to actually do our job. So we had to relearn everything about diagnostic coding. So I received this email January 22nd, 2014 at 5:41 p.m. and I opened this email around 7:30ish, right when I was about to leave for the day. So this is Michelle's email. Good evening, Sean. I am pleased to let you know, parentheses, and I wish I could see your face, end parentheses, that you scored 100% on your I-10 exam. Great job, Sean. So, in my professional life, I've always tried to carry the reputation that if I say that something happened, it absolutely happened. That way, I would be able to keep my reputation, and I was very credible and very reliable with anything that I would say in my coding career. And I've tried to make my personal and professional life the same way. Michelle was an awesome supervisor. She cared about the personal lives of her employees. She continues to be involved in my life even outside of work. I am so lucky to have Michelle as a friend and mentor. On this channel, we discuss how to obtain equality when living with mental illness. The topic for today is the importance of taking prescription medications when treating a severe mental illness. Now, why is this important? If you've watched my previous videos, you'll know that I live with generalized epilepsy and schizoaffective disorder. It's been my experience that without medications to treat these diseases, I would be disoriented within days, incapacitated within weeks, and possibly dead within months. I don't take medicine to be happy. I take medicine so that I can live. It's always been extremely frustrating to me when I hear somebody shame other people that need medications, especially for mental health purposes, where they have the attitude of, well, I don't need pills to make me happy. I don't need some artificial way to make me feel good. And quite frankly, if I had that attitude with the conditions that I have, I would be either severely suffering or possibly dead. People who need medications to live shouldn't listen to those people who shame people that need medications. And in general, it's a blessing to have your mind work properly without any help. So I feel people who shame others due to medication use don't understand what it's like. So I'm 40 now and I haven't had an emergent medical problem since I was 18. Michelle and I tried to shoot this video before, but it had to be scrapped because of just how graphic the descriptions of my illnesses were. So this is the sanitized, cleaned up version of what it's actually like if I don't take my medicine. So when I was sick at age 15, my mind was in constant fight or flight feedback loops. I had constant insomnia and muscle convulsions. I remember right before an area would convulse, it would itch severely. I had excoriations all over my body from itching. I was awake for a period of over 7 days. I could hear the scraping of flesh on my eyelids when I would tear and blink. Finally, after 9 months of this, I tried to starve myself to death. I went 6.5 days without food. I remember my jeans falling off in public in the adult psych ward before I passed out for over 70 hours. So, at the institution that I was in when I was first sick, they actually put me in the adult psych ward because I was so sick and I was disruptive. So it was really, really bad. And eventually they transferred me to an adolescent unit and I was started on a new antipsychotic. After I started the new antipsychotic, all of my symptoms went away in 2 weeks. That would have been nice 9 months ago, right, Michelle?
Absolutely.
That was awful. And if I had the right medications before I was transferred to a new unit, I would have had a completely different life. That was extremely traumatic. And remember, like, I was a boy when this happened. I was 15. On my 16th birthday, I was institutionalized, and the only present that I got, a nurse made me some cupcakes for my 16th birthday. And I had a candle on a cupcake, and it was really, really bad. So that's a sanitized, unexaggerated version of why I need medicine. That sucks pretty hard, doesn't it, Michelle?
It does. It does. Honestly, I don't think medication use should be something that people consider as I don't want to say disability. I want to say a stigma. You know, they may have that idea that because they don't need medicine that they're superior, and that is not the case at all. Anyone that has diabetes has to have medication to regulate their blood sugars. And I think that, you know, your medications within 2 weeks resolving your issues, that really speaks to the fact that, you know, it truly is just creating balance in your body so that you can function effectively. So, rough story, rough way to get there, but good lesson in the end, you know, just, you know.
And the thing about it is in our society, we create obstacles if you need medications. I feel if I'm going to die without medications, or at least suffer extremely severely, that you shouldn't have to worry about class problems if you need medicine. For instance, my medications over the course of a calendar year would cost $45,000 if I had to come up with everything myself. Now, right now, I have absolutely great insurance. Due to the insurance that I have, it's more expensive to get fast food once a year than it is to pay out of pockets for the medications that I actually do take. You know, the company that I work for is really good about, okay, we're a hospital. We want our employees and our employees' families to get medicine if they need to. We're going to give them great insurance if they get medicine through our company. Now, that said, for people who don't have that, most people have to go on disability in order to pay for medicine, and we shouldn't, as a society, make people have class decisions like that. And I know a lot of people talk about, well, I would just do what needs to be done. Like, these people are freeloading off of the system. And the thing about that is, to some degree, I know people who could be way more productive. I know people who could have jobs who have these problems, myself included. The road to getting where I need to get in order to work, be independent, have a career, it wasn't free. And quite frankly, when I decided to go to college, people laughed at me when I said that I was going to be able to pay for my own way, be independent, all of that stuff. When I said that when I was 19 and I first started college, in addition to missing several years of high school, I missed about almost 2 years of high school because I was sick. I was a laughing stock when I said that I would do all this stuff. So our society needs to be way more supportive. And in general, without medications, I wouldn't be able to do anything, let alone have a job that requires college education and licensure. Not even I have what it takes to deal with that. If you're sick to that degree, get the right medications and then learn to be a champion in that order, and start young. You and your doctor may need to try a variety of medications and dosages to figure out what works best for you. Really talk to your doctor, and if something's not working in your life, tell your doctor about it. Have an open dialogue with your doctor about the way that your health is going. If your illness isn't progressing the right way, you may need your medications adjusted. You may need to try a different medication. In general, one antipsychotic for me works really, really well. The first antipsychotic that I was tried on caused me to have very severe side effects. In addition to that, I have to have my epilepsy treated, and I need to make sure that the chemistry of the medicine that I'm taking doesn't interfere and works for both of those problems. So really have an open discussion with your physician and look at all I've done. And it's not because I'm gifted, it's not because I'm better than anybody else. It's because I have medications that allow me to do those things. So get the right medications and then be a champion, because I wouldn't be able to do it without the right medications.
Awesome message, Sean.
So, like we've kind of discussed before, there's no way to get the numbers on this because that's not the way American society is set up right now. But it's my speculation that a large majority of people who suffer from mental illness could have way better outcomes if our society didn't put social and financial obstacles in the way of obtaining medicine and treatment. Anything to add on that, Michelle?
I agree. I think, I guess I'll just say stigma is not a good thing. Folks that really don't encourage others to be their best really do kind of get in the way. But I think your message about, the order of getting yourself on the right medications and then going out to just do your best is absolutely a great message for folks that are probably listening to this discussion. So great messaging.
Well, thanks so much for being my guest, Michelle. I hope this video has been informative and helpful. Have an excellent rest of your day or night.